The American Academy of Pediatrics recommends that all infants receive a preventative antibody to protect against this severe disease caused by RSV. This new antibody is called nirsevimab, and it's given by injection. And we have a lot of questions. So to talk about this, we brought in Dr. Bill Hartman. He's the clinical trialist at UW Health. Doctor, great to see you. RSV really exploded last year. It sent a lot of infants to the hospital. So what is a preventative antibody? How does this work?
So this is something that people became familiar with during COVID. This is a monoclonal antibody. So we call it passive immunity. So rather than give a vaccine to these babies, we're actually going to give them the antibody to fight off the RSV infection. And so the antibody is really kind of this protective shield that we're going to be able to give these kids so that they don't end up in the hospital with RSV.
It's interesting because, yeah, you said the monoclonal antibody. We knew that from COVID, but that was given to people after they got sick with COVID. This is the opposite. This is given to infants before they get sick.
Right, and there was actually several clinical trials with the monoclonals for COVID that showed that it did prevent people from developing COVID, and it was effective as preventative treatment. Here, we're hoping to have that same effect, and at least 3 clinical trials looking at this particular RSV monoclonal showed that it was at least 80% effective in keeping children out of the hospital when they were exposed to RSV.
So now we've been told all babies need this. The big question, if you're a parent or you're pregnant, you're expecting, how do you get this?
Well, all hospitals should be stocking up on it. I know that the production is really ramping up because they're expecting this to be extremely useful and something that the American Association of Pediatrics has recommended that all kids going into their first RSV season receive. And then after that, if the children are susceptible because they're immune compromised, then going into their second RSV season, they should still be receiving this antibody. This antibody is good for up to 5 months after its initial injection, and so it does give a lasting protection throughout the RSV season.
And really, when we're talking RSV, and I know how common RSV is, but a lot of people are just kind of learning about this after what we went through last year. But that 5 months, that's when we really need to take this. When kids are at their youngest, that's when they're most susceptible, right?
Right, that's when kids are most susceptible. The area of the lung that RSV tends to attack is easy to get to in these babies, and the babies don't have any antibody protection at all. And so this is really a top-notch way of keeping your babies safe and keeping your babies out of the hospital.
And it's giving a lot of hope to a lot of parents. I mean, last year was so bad. We had a coworker, his baby was in the hospital. So a lot of people know this well, and this is science, once again, moving us forward. Dr. Bill Hartman, appreciate all the questions, answering them for us. We had a lot of them today.
Absolutely. Thank you.